Here the vaccine which is contraindicated during pregnancy is, options are, option 1 is rabies, option 2 is hepatitis B, option 3 is tetanus, and option 4 is varicella. So what are the recommendations for vaccination during pregnancy? So our discussion is based on the CDC latest recommendations on vaccinations during pregnancy. So we are following CDC guidelines here. Next thing is, what is the essence of this question? You can easily answer this question if you can understand there is always a theoretical risk of transmission of infection from mother to child or mother to fetus. There is a theoretical risk of infection when you use live vaccines. Live or live attenuated vaccines has a threat. So live vaccines are contraindicated during pregnancy. So the next part of discussion is, what are all the live vaccines which are available in the market? So there is a mnemonic for this. Try to remember this mnemonic. Rome is my best place to visit at. So this is the mnemonic, and first letter is giving a clue to the vaccine. R is rubella, O here is oral polio vaccine, M is measles, E is important here. It is epidemic typhus, not endemic. Please remember it is epidemic typhus. I here is influenza vaccine, and M here is mumps. B is BCG, P is plague, and T here is typhoid. It is typhoid oral vaccine, and Y is yellow fever vaccine. So try to ignore this visit part. So to make sense, it was placed there. So what is the mnemonic for live vaccines? Rome is my best place to visit at or to go at. Here, after understanding this, let us try to look at the CDC recommendations. The vaccines which are considered safe are tetanus and diphtheria toxoid. Toxoid is not live, right? Hepatitis B, and they say influenza if it is given in a killed form. The new forms of influenza vaccines are killed form. Meningococcal and rabies, very important. If a pregnant female comes to you with a dog bite, you can give rabies vaccination. So what are there in option? Rabies is given, hepatitis B can be given, and tetanus can be given. Varicella, if you go with our mnemonic, varicella is contraindicated, okay? And you see here, BCG is contraindicated, measles, mumps, rubella, varicella, and polio. These are all contraindicated and under special considerations, because as I told you, you cannot stop giving all the live vaccines if they're really required by a pregnant female. In that cases, okay, benefits will outweigh the risk, and there you can give anthrax, hepatitis A, Japanese encephalitis, pneumococcal, polio can also be given, typhoid, varicella, and yellow fever. So these can be given. So this question covers two parts. One is, what are all the examples or mnemonic for live vaccines, and the essence of the question is live vaccines are in a way contraindicated because of the theoretical risks, and CDC recommendations which are considered safe in pregnancy are tetanus, hepatitis B, influenza, meningococcal vaccine, and rabies vaccine. So the answer for this question is option 4.